what is stroke? How does it happen?
All general public is very well aware about heart attack. The stroke is also the same. It's a kind of brain attack.
Could you please guide us on how should we lead our life as a daily life?
Stop smoking, especially with this vaping culture
It's
in the
dangerous.
younger generation. It is very dangerous. 18-year-old with a vaping, fond of vaping, she presented to us with stroke in emergency at night.
Doctor, I would like to know the impact of stroke on daily life.
Impact of stroke to the patient is in the form of physical disability, communication, not able to take care of himself, his job, his social work and his social life, everything gets affected.
This strokes is about two types. Now it's hemorrhagic and of course ischemic. But what is hemorrhagic and how can we treat that?
Hemorrhagic stroke is basically, in ischemic stroke, what I have told you is there is stoppage of blood supply to a particular part of the brain.
So which is the right place at this hour, being in Delhi? Have people be aware of it that, if you see such symptoms, where to run?
So first of all, if you are seeing such symptoms, the immediately thing you should
Hello and welcome to Story Makers. I am your host Simran Nagpal and I would like to tell you here that today's episode is super special. Yes, we are talking about stroke pe rog. As the name suggests, you know what are we going to talk about. The most talked about topic at this time. We are talking about stroke and very alarming situation at present. It's one of the most foremost things that we all are suffering with. It's just not an ailment that a person who's old, elderly, who's suffering. We're getting to hear that the youngsters are also affected. This is quite an alarming situation, my dear friends. We really need to understand what goes wrong. What is this that, we are having strokes at a very young age? And to do this and to tell us about all, we have a very eminent personality with us. We have Dr. Chugh, who is the Senior Consultant and Director of NeuroIntervention Unit, Sir Gangaram Hospital, New Delhi. I'm very glad that he could, spare some time to come here on this platform and especially on the World Stroke Day. A very warm welcome to you, sir.
Thank you, Simran. Thank you for the kind words.
It is such a pleasure to have a person like you here. And of course, we are going to have great info today. The topic is quite serious and I would like to know all. So we would start with the very first question here, sir. We've always heard that, stroke is a silent killer. Literally it's inside you and the way it is growing. I would like to start with what is stroke? And how does it happen?
Look, we all are, almost all general public is very well aware about heart attack. We take about कि इसको heart attack हो गया या उसको heart attack हो गया. The thing is कि the stroke is also the same. It's a kind of brain attack where it happens in two ways. Whether the blood supply to the brain gets blocked or there is some leakage of blood from the blood vessel within the brain, some bleeding which happens in the brain, or there is stoppage of blood supply. And this is stroke. And why do we call it as a silent killer? Because in heart, what happens? Heart is a muscle. Whenever the supply of the blood to the heart stops, it induces pain. And brain is full of neurons, but whenever the blood supply stops, there is no pain. So there is no pain as a patient doesn't feel anything.
Okay.
That is the reason it is called as a silent killer. And this is basically stroke. So whenever we can classify basically stroke into two kinds. One is ischemic stroke. That happens when the blood supply to the brain gets cut off or blocked either by a clot or any thrombus or embolus or a plaque, atheromatous plaque. And the other is hemorrhagic stroke. Hemorrhagic stroke is something where there is some sort of bleeding in the brain. It may be due to any reason, but whenever the bleeding happens, and these two events lead to some sort of neurological deficit. Either a part of the body stops working, either you lose balance, you lose your speech, or you are not able to walk, there is loss of control in the body parts. This is stroke.
So when you say, there is some part of the body which is affected.
Yeah.
Now, I would like to understand, is it like stroke is only for people who are like the age? Is there an age to it, or like any youngsters can also be affected?
Look, Initially, when I started in my practice, we used to see patients mostly in the elderly population. But now, especially after COVID, we have started seeing a lot of younger patients also who are coming to us with stroke, especially ischemic strokes and hemorrhagic strokes, probably. Now, what exactly has happened, or COVID has contributed to it, or I can't exactly pinpoint it, but and post vaccination also a lot of people have started having ischemic strokes. I mean, there's increased tendency for clot formations in the younger generation also. Now the thing is the lifestyle is also very bad of the younger generation, present younger generation, and how much this is contributing, how much the other factors are contributing, that we can't pinpoint to any particular thing, but it's a culmination of almost accumulation of almost all the factors, as well as post-COVID, post-viral status, and this is exactly what is happening. And younger generation is definitely getting affected by this.
No, like I initially started with this, that it's an alarming situation, and we get to know that younger people are getting affected. Now, here I would like to know, you also said it's lifestyle disorders. Now, what is it like? I also see there are a lot of boys, youngsters who are gym freaks, but suddenly we get to know they had a stroke and they collapsed during, their workouts. Why is this?
Look, one thing is definitely there. Our body needs to be optimally used. Anything we do in excess, it's going to be bad. Right. Either we are gymming, and most of the gym freaks who are they're using some kind of protein, especially those bodybuilders kinds. Those who are normally active, do regular gym, regular yoga, everything. If you are doing a mixture of everything, your body is fit for that. Plus, along with that, you also have to maintain a good diet. And for heavy bodybuilders who are using too much of proteins, the protein boxes which you see in the market, or protein promotions you see that to build up your muscles and all those things, those proteins contain certain lot of synthetic things or something that we have seen a lot of patients who come to us with strokes, and most of them are using those protein boxes.
Okay.
This is a history. There's no one says that but we have found in our history that most of them are taking those proteins.
Okay.
And plus any injury, and those proteins, first of all, they increase the tendency for clot formation. And the second thing is they also induces some changes where the blood vessels become more prone for injury.
All right. Okay.
When you are lifting a heavy thing, or you are doing excessive gymming in the in a gym, and there is you are doing excessive workout. So during the workout, there is strain on your neck muscles, your blood vessels, and everything. And during that initial strain part, some injury to the blood vessel, wall of the blood vessel happens, and that wall of the blood vessel injury, that focal injury, becomes a seed for the clot to form, and from there the clot forms and suddenly goes up, and it leads to stroke.
Okay, so while you're working out, you don't even get to know that this could happen to you.
You just feel a neck pain or something, and eventually you may possibly get a stroke after a few days.
All right.
If not immediately.
So here, viewers, my urge to all of you here, like, of course, you're working out. That's the need of the hour. But what we need to take care of is the intake of proteins. Like doctor just told us that protein is something. So there is, we have to be cautious.
You should take natural proteins. You want to take proteins, take eggs, take grams, or take whatever, take paneer, whatever you want to take. But take something which is natural. Don't go for this synthetic over-the-counter proteins.
All right. So doctor, do we get to have any of the symptoms beforehand? Supposedly, if, if somebody is going to have a stroke someday, so is there a symptom which he could, sense? We get to know that, of course, this symptom is coming, and this could be, a stroke thing which is coming. We can foresee it. Is there a kind of symptom that we see?
Yeah, definitely. Yeah. Stroke usually strikes suddenly out of the blue.
Okay.
But in some patients who have underlying diabetes or underlying atherosclerosis or intracranial or whatever the have diabetes, blood pressure problems, uncontrolled sugar, and all those things, especially in elderly patients, most of the time they have some or the other kind of problems.
Exactly.
So their stroke usually starts giving some symptoms, some local numbness or local patient was unable to lift a glass few days back, but
Okay.
he didn't bother about it. He was eating something or he was trying to lift something and suddenly he lost balance or loss of balance. All these are mild symptoms which are called as transient ischemic attacks.
Okay.
These are basically patient develops a focal deficit for a moment of time and then suddenly it recovers. So these are the small signs and symptoms which patient has to notice. If he is observing all these things, he is having those symptoms, he should immediately go to the hospital, go to a neurophysician or go to a stroke specialist and get himself evaluated. A lot of times you may find that the patient is having disease in the neck or the vertebra or the vessel is stenosed.
Okay.
Basically, it is narrowed significantly. So from there, small things, small clots are going in, and they are causing these transient ischemic attacks. If you've seen this prior to having stroke, then you can definitely get it rectified. Go there, get it stented so that the blood vessel opened. Or if these are for ischemic strokes, and in case some hemorrhagic strokes also, for you need to take care of your blood pressure, you need to take care of your sugar, and if you have an aneurysm inside the brain, a big aneurysm kind of a thing, you can get it treated beforehand before the actual thing happens.
So here at this hour where we're staying, we cannot ignore a simple symptom
No.
as well. The moment you feel that you have something in your body which is not right,
Look,
you need to connect.
we are already living in a very toxic environment.
Correct. Absolutely.
Air is
Absolutely.
bad, food quality is bad, water quality we are using it's a lot of filtered water.
True.
So, and
It's quite unfortunate,
yeah,
but that's the time
unfortunate
that
for our
yeah.
society, but this is exactly this kind of environment we are living in.
Yes.
And plus, above all that, we are having a very bad lifestyle as compared to our ancestors.
Yes.
So that is again becoming one of the most contributory factors for the same, for stroke and other diseases also.
You really said it all, that it's, of course, it depends on the lifestyle. And of course, we are not leading a great lifestyle. I would like to understand here, when you say the lifestyle disorder, could you please guide us on how should we lead our life as a daily life?
Stop smoking, first of all.
Yeah.
Smoking or any other, especially with this vaping culture
It's
in the
dangerous.
younger generation, it is very dangerous. For lungs, it is already dangerous, but for rest of the body and brain also, it is becoming very dangerous. I have seen an 18-year-old with a fond of vaping. She presented to us with stroke in emergency at night.
Oh my God. Okay.
18-year-old.
That's sad.
So that we have to stop smoking and other things, take very good control of our diseases, that is diabetes or hypertension and everything. Do daily physical activity. Take less stress. That is something which may not be possible for anyone,
Yeah.
but anyways, we have to do some meditation and all those things to keep our body calm so that it releases less of
Right.
rectifies the antioxidant. And basically live a healthy life,
Lead
kind
a
of a
healthy
thing.
life. Yeah.
The
So
most
here-
important thing is to take control, because diabetes, hypertension, and smoking, these three things in together form a very deadly triad for whatever is for
Right.
any stroke formation to become.
True that. And I'm sure my listeners, it's an important day. It's an alarming day.
And stroke
We
is
all
does-
need to
and-
understand.
And one thing more, stroke is not only to the person, stroke happens to the family.
Absolutely.
Because
Absolutely.
once a person becomes bedridden, taking care of him and looking at him entirely for the rest of the life, it becomes a big burden for the family and becomes a big emotional trauma for the family.
Correct. Very true. Very
People lose the rest of the, first of all, the patient who has suffered a stroke, he loses his job if he is
Yes.
unable to go.
true. Yes.
To take care of him, if the family is not able to, doesn't have too much of financial backing or something, then someone has to leave his job to take care of him.
Absolutely. Yes.
So entirely the thing changes. The entire family dynamics, your financial dynamics, everything changes.
So when stroke comes, it just does not hit the person. It hits the entire
family.
family.
It's the entire family.
Now here I would want to know, like somebody's got affected with stroke, we've also heard that time plays an important part.
Definitely.
Now, what is it that, could you just tell us the whole process?
Look, for the whole stroke thing, one mnemonic we have to remember, that is called as FAST. Any facial drooping, weakness in the arm, or that is slurring of speech or speech difficulty. If you are seeing any these three symptoms, you should immediately, the last is T is time to go to emergency.
Okay.
Basically, it's
Okay.
as simple as that.
Right.
FAST. F for fast, facial
Okay.
drooping. A for arm or any other weakness in any part of the body. S is for speech, speech difficulty, or you are not able to speak, or suddenly the speech has become slurred. And that T is for, that means it is, if you are seeing any of the above three, time to go to emergency or time to call the emergency services. Now, as soon as you reach the emergency, or the time plays an important role, because every minute, whenever the blood supply stops to the brain, every minute almost 1.9 million neurons, that is 19 lakh neurons, start dying.
Okay.
Every minute. So every minute, almost 1.9 million neurons start dying. So our purpose for ischemic stroke is to restore circulation, remove that clot as soon as possible, to save whatever what we can. जितना बचा सकते हो बचा लो. So basically, there are two treatments for ischemic stroke. First of all, whenever we reach the emergency, the first thing which is done is to get diagnosed the stroke. You go with particular symptoms, doctor will take care of the history, we evaluate, take care of this, and everything will be there. Our team is also there. In our hospital, whenever it happens, our person goes, takes the history, and immediately rushes the patient to either a CT scan or an MRI.
Okay.
These two can vary depending on the kind of facility which is available in the center. If you don't have an MRI which is available 24 hours, the only thing you get is CT scan, so get an immediately CT scan done. Now, CT scan will first of all help you identify whether it's an hemorrhagic stroke or an ischemic stroke. If it's hemorrhagic stroke, then the patient goes for hemorrhagic stroke management. If it's an ischemic stroke, then time window also becomes very important. For ischemic stroke, as I told you, every minute 1.9 million neurons start dying. So this is there. So for ischemic stroke, the time window for injection, that is called as clot lysis injection, called as either alteplase or tenecteplase, that we can use up to a window of 4.5 hours. If it is not a very large, but definitely for giving that injection also, patient has to be fulfill the certain criteria, the size of the stroke, there is no hemorrhage within it. So all these things definitely has to take care. If CT scan is not there, then we go for MRI. Once the patient is in MRI, we do the MRI, and once the MRI is done, we get all the required information. What is the size of the stroke? Where is the clot? We can also do an MR angio along with that, MR angiography of the brain. By doing that angiography, we can definitely pinpoint this is the vessel, this is the size of the clot, and this is the vessel which is occluded.
Okay.
So thereafter, we can immediately take a decision what exactly needs to be done for the patient. Whether patient goes for IV thrombolysis, that is the thrombolysis clot lysis drug injection, which I have already told, that is it is alteplase or tenecteplase, whatever is available in the hospital. Or patient has to go to immediately to cath lab for a procedure called as mechanical thrombectomy.
Okay.
This is the same kind of procedure which the cardiologist does for the heart, to open up the blood vessel of the heart for an acute heart attack patient. In this procedure, we go inside, do an angiography, shift the patient immediately to cath lab, go inside do an angiography, go inside that particular vessel and try to take out the clot either using a stent retriever, which have our own devices, or an aspiration device, aspiration catheter, and we take out the clot. So that this entire exercise or purpose of this exercise is to restore the blood flow to that area as soon as possible. Once the area is reperfused, then the chances of recovery of patient are much, much better as compared to.
Okay.
But that still doesn't mean if we have opened it up and the blood vessel is open, that the patient will recover 100%. We are increasing the chances of patient to become much better, but that doesn't, because some damage starts happening immediately within 3 to 5 minutes after the stoppage of the blood supply.
Okay.
This is the only period where the cells can be viable without fresh blood.
Okay.
Because blood carries the oxygen and nutrients to the
to all the systems we have.
Yeah.
Now, again, here, when I listen to the entire thing, like you said, time plays an important part and how it happens. Now, the entire thing, the only thing that came into my mind is, since we know that, we're talking about stroke, we also have heart attacks. Now, of course, what is the difference? I would just like to have a small, idea of, like, stroke is a brain stroke and heart is a heart attack. Now, equally, they both have different symptoms. Could you quickly just, sum up, like, let us know what is the difference between?
First of all, heart attack patient presents with a chest pain or heaviness in chest, or he's having breathlessness. Brain stroke doesn't show any of these symptoms. It is painless. Patient may be having not what I told you earlier, that is the main symptoms are fast. You have to remember a mnemonic that is fast. Facial drooping. And it's basically your face becomes kind of deviated. You are not able to speak. If you are trying to drink something, it starts drooling out of your mouth. That is basically you are losing control of your part of the face.
Yes.
You are having some weakness in the arm or legs or something which you are not able to move, or you have started walking and you are not able to walk properly. You have a tendency to fall towards one side. You are feeling you are dragging your leg. That is also one of the. You are having difficulty in speaking. That is called either maybe you are having some slurring of speech. You are not able to speak, or sometimes you want to speak, but you are not able to find a word. What exactly the word I'm going to speak? You are just you start talking gibberish with no relevant talks or something. But you are, because that stroke particularly involves that part which is involved in your word formation and word processing. So if that is not there, you will be able to speak, but whatever you are speaking is gibberish. The other person sitting or standing in front of you will not be able to understand whatever you are speaking. So these three symptoms, plus you are unable to walk, you are losing imbalance, you are feeling dizzy, giddy. These happen in the stroke to the posterior part of the brain. So these things are there.
Doctor, I would like to know the impact of stroke on daily life.
Look, the impact of stroke to the patient is in the form of physical disability, communication, lack of communication, not able to take care of himself, that is no self-care. And with all this, his job, his social work and his social life, everything gets affected. Because he's not able to walk by himself, he's not able to talk by himself, and it all depends on the extent and the severity of the stroke. He develops some cognitive changes also, memory changes, mood changes, and all these things depend on the location of the stroke, where exactly the stroke has happened in the brain, which part of the brain. And so a lot of times patients who become partially conscious or become conscious but they still have some deficit, maybe either not able to speak, or not able to walk by themselves, especially in patients or sports patients who used to be participate very actively in sports, and they suddenly develop a stroke and they become sort of bedridden, or they are not able to even take care of themselves. So they become highly depressed. It's very natural for a person to become depressed when he is not able to take care of himself.
Correct.
So here comes the role of the family. First of all, family has to take very good care of him, and they have to build a kind of environment which feels supportive. Sometimes the patient is not able to speak, and the same thing, the way we teach a small kid to learn or speak, or these are the words, the same way you have to teach him. This is exactly what happens in speech therapy and something like that. So here the role of the family and the social environment around him, that matters a lot.
Like you initially said that it's not the person's loss, it's of course the loss of the family.
Stroke happens to the family.
To the family. Not it has to be that when a person is going through such severe thing, it has to be like that the family should be supportive. You have to have that atmosphere for them to be, feeling nice and positive,
And
like you
positive.
insisted upon. Now, okay, coming back to one very technical question here. You'd been mentioning about this strokes is about two types. This
Yeah.
brain stroke, not it's hemorrhagic, and of course the other one,
Ischemic.
ischemic. We know ischemic, that we know you've told us a lot about. But what is hemorrhagic and how can we treat that?
Hemorrhagic stroke is basically in ischemic stroke. What I have told you is there is stoppage of blood supply to a particular part of the brain. In hemorrhagic stroke, what happens is there is hemorrhage in the brain. That is called as brain hemorrhage. अगर आपने normal भाषा में सुना होगा
जी, जी.
किसी को brain hemorrhage हो गया.
Correct.
That is exactly what brain hemorrhage. There is some rupture in the small vessel or large vessel which has led to this stroke, and there is accumulation of blood in the brain, which is called as hemorrhagic stroke. Now this also can be either hypertensive, where it happens in one of the small vessels, or it can be due to some already present some abnormality in the blood vessels of the brain, which can be in the form of an aneurysm, which is an outpouching in the brain, a kind of balloon formed in the blood vessel of the brain which ruptures, which leads to a hemorrhage called as subarachnoid hemorrhage. Or it can also be because of a bunch of abnormal blood vessels in the brain, which is called as AVM, arteriovenous malformation.
Okay.
So all these things they all constitute a group called as hemorrhagic stroke.
Okay.
So there the treatment is different. In ischemic stroke, what we do is we have to open the blood vessel, and here we have to occlude this rupture part if we are able to. That is exactly is the difference. Where we have to occlude the leakage point. For these diagnosing these, again the first thing is CT scan followed by an MRI or MR-angio or a CT angiography, whichever is required. Depending on the findings, whether we find an aneurysm or an AVM or it's a simple hypertensive bleed, usually management is followed.
All right. Now, coming back to this, again, a very important question. Somebody's got affected at an hour which is late at night, and you don't get to understand where to take care because the family doesn't know what's happening, and immediately some kind of symptoms if we see. So, which is the right place at this hour? Being in Delhi, we are like getting to have people be aware of it that, if you see such symptoms, where to run.
So first of all, if you are seeing such symptoms, the immediately thing you should is, if you have a family physician or a neurophysician in your family, or you're already in consultation with a neurophysician, because most of the patients are having some or the other. Immediately, if you are able to contact him and ask him for advice, and if he, or you should go to a nearest big tertiary care center,
Okay.
which should have a good comprehensive stroke care.
All right.
By the word comprehensive stroke care center, I mean a place where you have a neurophysician, neurosurgeon, and a neurointerventionist. All are available. Neurointerventionists are the one who will do the angiography and take out the clot if required.
Okay.
For that, you need a proper comprehensive stroke center. Right now, in my hospital, that is Sir Gangaram Hospital, we have a fully functional stroke care unit, and we are 24/7 available round the clock for acute stroke services.
All right. There was a great information, and of course, being in Delhi here, it is highly required. People should be aware of where to rush, and if just not in Delhi, you know where to rush. Comprehensive Stroke Center is what we are looking at in case, and if it's unfortunate, somebody's got affected. Now, towards the end, I have again a question as an advice to all the people who are watching. It's a special day. We are here celebrating, or maybe we're talking about World Stroke Day. What is your advice to everyone who's watching here? How should you lead your life to be aware of this?
Live a healthy life, first of all, healthy lifestyle, and maintain your weight. Take good control of sugar and blood pressure, or take good control of your diabetes if you have it. Take good control of your blood pressure. Maintain an optimal weight. If you are obese, take care of that. Start doing some physical activities and take good care of other, if you have any other associated diseases, you also have to be very good in tackling that. You have to take care of yourself, because once it happens, if anything happens to you in the stroke kind of thing, then the rest of the other diseases will also get exaggerated, and that they will also start impacting the outcome of your stroke. So this is exactly, and it's more of, and the other thing which you have to remember is, in case, God forbid, despite taking care of yourself, despite doing all the things, in case you develop such kind of symptoms or sudden symptoms of stroke, immediately rush to a nearest tertiary care hospital. That's it.
Okay.
Because time is brain, or if you reach early, if you reach there as early as possible, there are higher chances that you may get better by either by injection or by taking out the clot. The more you delay it, the less better will be the outcome.
Thank you so much, doctor. The entire interview, I got to know so much of this very dreadful thing. It gives me a lot of pain, seeing it through my eyes. Somebody going through this. But yes, we had to talk about it because this is the time that we all need to be aware of our body. And you gave a very wonderful advice that we need to take care of our body. That should be the foremost thing. Stay positive and, of course, stay healthy.
Yeah.
That's the motto. Thank you so much.
Motto is stroke pe rok.
Stroke pe rok. Very truly said. Thank you once again for being here and giving your precious time to us. Thank you. And my dear audience, coming back to you all, we are here talking about stroke pe rok. Yahi karna hai aapko. Please be aware of what all happened in the interview. Please see to it. Make sure that any of your family members, God forbid, is going through. Be supportive, and of course for yourself, be healthy. And yes, stroke pe rok. See you soon. This is Simran signing off.